Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. My assistant Shaykhmet and second assistant is Sagnish, our resident, neurosurgical resident, and this is a case number 2. A 63 years old lady had a headaches. Yes, she had a headaches, and on MR with the contrast, it was a brain trauma after car accident, and she had the headaches and imaging done, and on imaging this meningioma was found. And okay, let's see the venous face. It's draining to the transverse sinus. There is no edema, and there's a small feeder from the MCA on the anterior part. It's look like parietal branch of the MCA. Okay, and MMA, middle meningeal artery, is nicely seen, and this is very nice indication for the embolization and resection. But maybe in microsurgical hands it's also possible to resect. But all the time there is a risk of bleeding. That's why we prefer to do embolization for such kind of meningiomas. And in some cases, if there is no increasing of the symptoms, it's possible to leave the meningioma, and usually it's decreasing in size and no need for open surgery, even if it's 6 centimeter. Okay, 7 French Asahi Hyperion. It's a guiding catheter. We are preparing Sonic 1.5 35 with the hybrid 8 inside, and additionally will be microcatheter headway duo, and we are planning to place a couple of coils and inject squid 12. Okay, we have Optima and 2x8, 2x6. Yes, I think 2x6 helical soft, super soft Optima with 1.5 complex soft. Okay. Так, микрокатетер açmışsın mı?
Ya.
Kaçsın açtılar?
Headway 156 и Sonic пожаром.
И Headway
Вот 156.
156.
Фен керек па?
Фен керек жоқ. Окей. ДМСО жине салу керек. This year we have additional quotation. We finished our main budget in November, and now we have additional cases. That's why it's a weekend cases in December. And today we have another 2 cases, but Maksat is planning to do the cases. Headway емес, неге саласың? Біреу жет. Соникқа сала бер. And tomorrow we are planning 1 or 2 cases, basilar aneurysm with recanalization. And the second case will be... Киржих Владимир. Киржих. Так, тағы да бір шприц бере салыңыз. 20-ка. Болады. Yes, Maksat is planning a couple of cases. We will not stream. Hello, hello. And tomorrow we have basilar aneurysm after coiling, and it starts growing. And tomorrow morning we will start that cases. And for today it's the last case, and then I will try to have a rest. And this is Almaty, and my main working place in Astana Presidential, and this is Almaty Presidential, 1,000 kilometer distance. It's just 1.5 hours by plane. Общий?
Да.
Жақсы адамдармысыңдар ғой. Жақсы адамдарым деген программа көрдіңдер ме?
Жақсы адамдар деген көрдім.
Иә. Наружный сонға кіре салмадым. Ладно, жарайды.
Мен жаңағы
Шахмет said he's in the
кішкене соны алып қойғанмын.
common carotitis. It's okay. It's all the time okay. 2-6 спиральді аштыра бер. Okay.
Бақ түркен астында
I have a protection system zero gravity with the magnet. 2-6 біреуін ашып тастайсыңыз. И отделалкасын дайындап қоясыңыз. Иә, ашып бересіңіз. Шахмет is a great guy. It was a prevention of the vasospasm in external carotid artery system. Usually it's not so big problem. Extracranial circulation is quite safe territory. It looks like maxillary artery. Okay, it's coming a little bit proximal. Okay. Sometimes microcatheter is going easily. It's a sonic. Okay. Yes, that's very nice. Now we are in place. It's a meningioma. Okay, now it will go. Okay. Just a second, I need to push my guiding catheter up. Okay. Oh, it's good. Just a second. So, doing this also. Кастратор чухал через ход выдуваешь. Okay. Take this like this. This. A little bit like this. It's okay. Because of the spasm, the visualization is a little bit worse, but it's okay. It's okay. Now we will take a smart mask. Yes, it was a question from Orlando. How much difference between the price of Scepter Mini and combination of microcatheter with coils? Yes, combination of microcatheter and 4 coils is the same price like a Scepter Mini. That's why we took a headway duo with planning headway duo with coils. Okay. Okay. Okay, that's better. Bir tampon verirsin. Yes, now our young colleague Abzal in Nagoya, in Nagoya, together with Professor Yoko Kato and Shaykh Ahmed, this young neurosurgeon
January 7th,
planning to
till the end of
go to Nagoya in January, no? Yes, in January.
2 months.
Oh, 2 months. For 2 months, okay. Yes, thanks to Professor Yoko Kato. It's a good chance and opportunity to learn from the best neurosurgeon. Okay, this is proximal one and this is distal one. We can pull a little bit the sonic. I think it's possible to pull it a little bit. Okay, I think now is better. And this is position for the header. I pulled. Okay, I will push with coil. No problem. Okay, no problem. Let's do it with the coil. Iterer. Yes, it's headway duo 156. Iterer. И бір жағында 4 ашып себерсінші. Бақыт келесі спираль ашып себерші. Бір жағын 4. Ничего себе. Я ашайыр. Okay, Shaykh Ahmed. Let us damage the coil. Okay, let's take it out. Gibrit verir.
Batırsanız.
I know what to do. Yes, it's sometimes possible when you manipulate with the syringe, you can move the microcatheter, which was happened in this case. Okay, this place is. Портер. Да, держали дырысо. На удержали, да? А двойканы қайтадан чехолына кигізе саласыңдар. Все, итерер. Итерер. It was some damage at the distal part. Okay. I will do it a little bit proximal. I will leave this coil pusher. Traversen. Now, что Вот, Джерисо. Джерисо. Okay. We just push inside the microcatheter, and then we can push with the pusher of the first coil. It's a 15-minute procedure. Yes, when you have a pause, it usually happens like this. That's why specialists need continuous
Вот эти моменты, мне кажется, не
education. Yeah. It's okay, it's okay. It's a part of life, no problem. We're trying to save a little bit money. Kaçını verirsin?
Красный, да?
Все тартар. Тартар. Слишком жмзах похож. Все хорошо. Стоп. Так, теперь максимально сколько сможешь итерешь. Yes, now we need as much as possible to push the coil inside the... Так, и потом на ноги вверх. Хорошо?
Ага.
Чехол на кисель.
А он так не умеет?
Все?
Тоже. Тяжелый же, тяжелый. Мазғалдық вообще.
It happens when you
Харри.
have assistant neurosurgeon. Yes, it might happen. Huh? I am joking, yes, but it's part of life.
Part of education.
Part of life and part of education. Yeah. Okay. Maybe now it will go. Let's see.
Понимаешь, когда сағыныш.
Анан кийиндире бер. Okay. Now it was damaged. At this point, we need to. Okay, I tried to detach and to create a free coil, like Bernstein coils. Okay. Maybe it will. Okay. It went with the flow. Okay. Now I will take the pusher of the previous coil. To push the second coil. Just a second. Yes. Okay. Yes, now coil was delivered. Huh? Okay, we will take a little bit back. Headway. Just a second. Тартер. Так, наркоз поглубже, дексаметазон уника.
Шықпай да?
Окей.
Бақтырырым olan.
Лахасын. Дексамник. Так, окей. Демсон бересің. Okay, let's take DMSO, dimethyl sulfoxide, and squitonica. Squitonik жинайыр. И қалдығын екінші шприцқа жинай саласың ғой сразу? Сразу екі шприц. I'm asking Shahmed to fill both syringes with the squid 12. Бері сал. Біреуін бері сал. Okay. It's a squid 12. Глю қойып беретін адам бар ма? Глю. Пока стоит. Так, номер радиосы. Окей, рахмет. Это squid 12. Хорошо, ничего страшного. reflux is just coming. It's not the problem. It's a middle meningeal territory, that's why reflux is not the problem. Ana naçnik hücresi. Все, рахмет. Пока, Кирюша. Это? Okay, let's look. Yes. It could be small branches also feeding the territory. I will leave the headway duo. Maybe at the end we will inject a little bit at the remaining part of the meningeal artery to prevent the subdural hematoma after meningioma embolization. Okay. Okay, now it's going inside.
Кстати, субдуральный гематома хронический протоколын жазып қойдық қой.
Молодцы. Кімге бере салу керек? Исламбекке.
Алдымен бір қағаз бере саламыз.
Молодцы. We need to flush this contrast. Just to see clearly where is the reflux. Good. Еще. If you see the tantalum in the squid, it's a different range of gray. Yeah? It's not the same contrast enhancement of the liquid embolic on the up screens. Okay. Now we're inside the meningioma. Еще набирай. It goes. Yes, maybe it's time for extravasation. No problem. Almayı тұратыр. Reflux кетіп қалды. There's a reflux, that's why maybe we need to finish the case. We don't need so long reflux. Just to clear it. Yes, it's a little bit back. That's okay. Даем сюда напиши. Yes, we discussed with Adnan and liquid embolics, which we have on the market. It goes only for bigger diameter of the arterioles, but the smaller diameter is not possible to reach with liquid embolics. Now we can see there is a small part in distal territory. It's very important to keep the control. As you can see, there is a collaterals. It's a distal part of this meningeal artery. No problem. Demus versa. Now I will take DMSO to take out my sonic, and also I will try to fill the remaining part of the meningeal artery with this liquid embolic. Okay. Okay, now it's starting to fill inside. I think it's a vein or it's extravasation. No? It looks like extravasation. Okay, without any problem, it was detached. Okay. Headway door is in place. Maybe small part is filling from these arteries. Сквит че не сър? Буквально джарт кубик. Сквитоник е. Okay, I will fill the remaining part with this the headway. To prevent the subdural hematoma during the embolization. It's a prophylaxis. Huh? Yes, Sheikh.
Yes, prophylaxis of
Subdural hematoma during the resection.
intraoperative melanoma.
Okay. I think it's enough. It will start thrombose and no need to increase. Okay. Next now. Okay, now we can finish the case. Okay, first angiography, better to do from the same place in extracranial. If there is any thrombus, it's a prophylaxis of emboli, and then you can pull the guiding to the common carotid up here. Yes, a small part is remaining with no problem. MR possible on Monday. It's Independence Day in Kazakhstan. That's why maybe tomorrow. MR is not working. Yes. Okay, I think now we can do control CT. Control. Control. Now we'll do CT, and after CT we can finish. Usually we do MR with contrasting 2 days after embolization. Today is Saturday, on Monday is better, but MR is not working. We will see the clinical symptoms, but it's look like atypical meningioma. But there is no edema because the veins draining the meningioma is not compressed, not involved. That's why. Okay, let's see the CT.
Bak planşet eğer gidecek жолдой болсайды келет деп еді.
Там, короче, ақшасын төлемесе келмейді.
Алып қойған, ақшасын бәрін алып қойған ол. Алып келу керек болсайды.
Зоб есть.
Есть?
Зоб.
Бақыт, шақырып.
Жень, включиться.
Мақсат берешіктен қойды.
Okay, this is control CT. On AP and lateral, it was look like not so much liquid embolic inside the tumor, but now you can see it's full of embolic inside. Okay. Stuff like this. Okay, now we'll finish this case and see you tomorrow. Tomorrow we have 2-3 cases. We'll start at 8:30 Astana time. Okay. Okay. See you tomorrow. We'll follow the patient. If the symptoms will increase, then it's a resection. If she will be asymptomatic, maybe we can follow and it may resolve. Okay, let's see. See you. See you tomorrow.